All right, hi there. This is Corey Autry. This is my informative speech for my Fundamentals of Speech class, and here's my audience. All right. The topic I've chosen is EMDR, which stands for eye movement, desensitization, and reprocessing. EMDR was found to be more effective than Prozac in treating PTSD. The difference was that Prozac provided relief only while patients were taking it, whereas EMDR had lasting effects even after treatment had ended. This is from Bessel van der Kolk, MD, his book, The Body Keeps the Score. In 1987, Francine Shapiro was walking through the park when she realized that some of her more troubling thoughts that she had become less troubling. Curious about what had happened, she retraced her thoughts and images and came to the same conclusion that they were less troubling. Recalling the context of her behavior and her surroundings, she was able to come to the conclusion that her eyes had been quickly moving back and forth. She then began to suspect that rapid movement of the eyes may have some therapeutic powers. This is how it all started, but the full history of EMDR is for another time. I'm here to just give you a brief overview of what EMDR is. No, you can engage in EMDR sitting or lying down. Who hasn't thought about those scenes in the movies where somebody's laying on a couch next to a therapist? But don't worry, if you do EMDR or any kind of therapy, you're not crazy if you lay down. EMDR has 8 phases. The first phase is patient history. This is where the therapist will discuss the history of the patient and they will create a treatment plan. The second is preparation. This is where the therapist will teach coping skills and introduce EMDR procedures. Third is assessment. Here you will focus on a target memory. You will identify its worst image, negative belief, associated emotions, body sensations, and rating disturbances. Desensitization, which is the bilateral stimulation, and it's used to reduce the emotional charge of target memory until it's no longer distressing. And bilateral stimulation is eye movement back and forth, or they use what they call tappers, which they're vibratory sensors they put in each hand and they vibrate back and forth. This helps to mimic your REM cycle when you sleep. Next is installation. Installation of a positive belief. I am safe, I am loved. Those positive beliefs become strengthened and integrated using the same bilateral stimulation. In the 6th phase, you will do a body scan. This is just kind of in your head, you will scan your body for any lingering physical tension, sensations related to the memory, and process them with bilateral stimulation. Any of those sensations could be what you felt at the time of this memory. Phase 7 is closure. At the end of the session, the therapist will ensure you're stable and calm, reinforcing coping skills. And then 8 is reevaluation, which is typically at the start of the subsequent session. You will discuss the previously processed memory and ensure the distress is still low and positive cognition is still strong. And then you will talk about future targets at that time. EMDR has been found to help process trauma more effectively, while medications like SSRIs or antidepressants treat the symptoms such as anxiety and depression, but they don't treat the trauma in the past. Antidepressants typically have more physical side effects, while the side effects of EMDR tend to be heightened emotions, vivid dreams or nightmares, and headaches. Not so much on the physical side, more on the emotional side. You can think of this as a sense of rewiring the brain or debugging the brain. It also mimics your REM cycle, as I stated before. In my own work through EMDR therapy, I found that this process has been extremely beneficial. In my most recent experience with EMDR, I've reprocessed memories from my early childhood, specifically around a relationship with my father and the abuse I endured as a child. These memories hurt far less than they used to, and I've been able to forgive my dad and give him grace, just as I've been given grace by the Father. Statistics on EMDR treatment has shown that the individual receiving treatment has overcome past trauma. EMDR Institute Inc. stated that 84 to 90% of single trauma victims no longer show post-traumatic stress disorder after only 3 90-minute sessions. from emdr.org. 84 to 90% is a great outcome for any form of psychotherapy. A study conducted by HMO Kaiser Permanente found that 100% of single trauma victims and 77% of multiple trauma victims no longer were diagnosed with PTSD after only 6 50-minute sessions. In another study, 77% of combat veterans were free of PTSD in 12 sessions. This is again from emdr.org. A lot of research has been conducted on EMDR therapy, and it is now recognized by the American Psychiatric Association, the World Health Organization, and the Department of Defense as an effective treatment for trauma. Again, this is from Bessel van der Kolk, The Body Keeps a Score. And in conclusion, we can confidently say that EMDR is one of the most effective treatments of trauma. There are many who have come before us, such as Dr. Francine Shapiro and Dr. van der Kolk, who have paved the way for EMDR as a primary source to heal trauma and PTSD. EMDR therapy has transformed the way we process trauma in the mental health industry. Thank you.